Hello, everyone. I am Rama K. Ramaswamy, and today I'll be interviewing Dr. Vin Gupta on behalf of They See Blue. They See Blue is a grassroots community organization coming out of the San Francisco Bay Area with a mission to mobilize and engage Americans of South Asian origin in the democratic process of helping Democrats win federal, state, and local elections. Dr. Gupta is currently Amazon Care's principal scientist, where he provides clinical and strategic leadership to the company's growing effort in improving efficiency in primary healthcare delivery at scale. Prior to this, he received his BA from Princeton, MD from Columbia, a master's in international relations from the University of Cambridge, a master's in public administration from the Kennedy School of Government at Harvard, and he is a term member of the Council for Foreign Relations. He's also a regular healthcare policy contributor for national media outlets and a board member on several health-focused nonprofit organizations nationwide. Prior to Amazon, he was an affiliate assistant professor of health metrics sciences at the Institute for Health Metrics and Evaluation at the University of Washington. Dr. Gupta holds an active commissioning as a major in the United States Air Force Reserve Medical Corps, where he serves as a deployable critical care aerospace physician for the 446th Aeromedical Staging Squadron. That's a mouthful. Dr. Gupta is committed to voicing evidence-informed perspectives across a range of critical issues, such as domestic healthcare reform. Welcome and thank you. So I'm going to start off by asking you where you grew up.
My wife and I are both from Northwest Ohio, and we actually met on a school bus as elementary school students in a little suburb of Toledo called Sylvania. And so we're really connected to that, to Ohio, even though we live in Seattle right now, and that's where our folks live, and a large Indian community actually that really keeps us together.
Right. Well, you'd be surprised to know that I know all about Ohio. I went to college there, so that's another story.
Oh, okay, awesome.
Yeah. Awesome. From Ohio.
Where? Where'd you go?
Went to OU.
Oh, okay. You went to OU.
Right.
Okay.
And I used to be a geologist, so I've transversed all of Ohio up, down, and sideways. So you're right. But so let me ask you the next question. So when you were young, did you think that one day when you grow up, you're going to be doing all the very cool things that you're doing right now?
I will say I grew up in a really traditional Indian household with first generation, I'm a first generation American. My parents were Indian immigrants, and I didn't really know what to expect. And so my definition of a success was looking at their example of it, which was something I still think to this day is unreachable, coming from India. Really with not many belongings, and then finding footing in a country where things were difficult. They're still difficult for immigrants, so don't get me wrong, but then carving out a really sustainable career for themselves, and then ultimately providing a really privileged childhood for myself and my brother. And so I always viewed their example of success as a metric by which to measure my own. That has changed as I've experienced more of the world, but I had always thought that the success that our parents broadly in immigrant diasporas across the country is unreachable, and what they've done is incredible. And so while I've taken a different path, I continue to admire what has come before us.
Excellent. And did you, what made you decide to go into medicine, specifically pulmonology of all things?
To me, I had always had an interest in improving how society works, and taking a problem, whether it be a public health problem or an economic problem, and using a whole society approach to tackle it. And I think in no greater way is that need more salient than the COVID-19 pandemic. Right. And I was drawn to healthcare, to answer your question directly, because I feel like health, if a society is healthy, then everything else falls into place. People are happier. You have less mood disturbances, less addiction disorders. You have people more productive, and the economy prospers. You tend to see less crime. Health is so integral to just a happy, healthy, functioning society. And so as somebody who wanted to tackle cross-sectoral problems, wanted a whole society approach, I thought as a clinician, as a public health practitioner, I could add positively to any crisis. And I didn't expect that, soon into, I say the middle part of my career, something like this would happen, but I feel well positioned to hopefully add value.
Right. So you've been quite vocal, and this is kind of a two-part question, so bear with me. You've been quite vocal in our national media about healthcare and healthcare policy, and as well as this pandemic. And I think you had this great interview recently in February with Al Jazeera, where you were on the interview saying to everyone that we should get ready as Americans. This pandemic is coming, and we should get ready. And subsequently, just this last September, you were on a MSNBC interview where one of the participants was an Air Force vet. Her name was, I think, Sarah Samir. And she was talking about how she was pretty sure she contracted COVID, but then was subsequently denied access to any kind of testing for months and months. And after a long, phone call, series of phone calls, she was mailed amoxicillin and an inhaler in the mail. So my question to you is this what we should expect going forward as this whole thing rolls out? And in your opinion, how was this handled by the White House at the onset?
Really important questions, and I will do my best to answer them concisely. And I remember both interviews well, even though they feel like a lifetime ago. A direct answer is this pandemic has been handled criminally from a negligence standpoint. If I did to my individual patients or the communities that rely on me as a physician to keep them healthy and prosperous, if I knowingly did the wrong thing or knowingly misled my patients about what they could do to protect them and their family, I would lose my medical license. There would be repercussions, as there should be. And in this case, there is not. There's deflection, there's denial, there's lack of ownership. And it's not just what it means for our current reality, which is we've lost 200,000 plus American souls, probably 60 to 70% of which were needlessly lost, preventable deaths, had the right things been done early on. So that's one. That worries. What we're seeing right now, the politics that are interfering with our pandemic response are costing not only lives in the present day, but I worry about what the future looks like. What do the subsequent months look like? There's no confidence right now that anybody who is an expert in public health is actually guiding policy. It's just all about electoral politics right now. We've lost trust and faith in any of our public health spokesmen outside of, say, Dr. Tony Fauci, who's muzzled often. So there isn't a lot of confidence here, but it worries me about what this is laying the groundwork for when it comes to, God forbid, another pandemic in, say, 2023. We're going to be caught flat-footed because we're walking away from the WHO, we're walking away from global engagement. We don't have the right people and experts within government to create that connective tissue, interagency connective tissue. These things matter. A forward-thinking approach about the next pandemic matters even while we're in the current one, and we're not doing any of that. So 4 more years of what's happening now is going to be injurious to what happens next. We're going to be blind to it entirely. We're not going to be ready for it. And it's going to be much worse. If we think this is bad, it's going to be a lot worse. So that's number one. Number two, I would just make a quick comment that in referencing what you had mentioned some of my earlier interviews, the fundamental problem in politics is that we don't have a representative democracy. We have people who should not be representing us. I had a former mentor of mine call it adverse selection. People who enter politics tend to do so because they have nothing better to do, or they have a lot of money, or they're a legacy individual who shouldn't be there on their merits. And as a result, we have people there making decisions for us who are not experts, who in many cases are not public servants, and who have an internal agenda, usually money driven, usually because they have industry affiliations or they're fulfilling some sort of pork barrel interests, but they're not for the people. And they certainly aren't public health experts. And if there's one thing that this pandemic has taught us, is that there's one threat out there in the world that can bring us to our knees, the worldwide population to its knees, and it's a biological threat. We just don't have the right people in place to lead us.
And if it had been you, if it were up to you, what would you have done differently, right from the get-go?
I've been on record saying this, and so I feel like none of this is not authentic. I was saying as late February, early March, that we should have done a national shutdown, a national lockdown for 6 to 8 weeks, where every single state abided by the same set of rules, not 50 different approaches, would have fundamentally led us down a path that most of Europe has experienced. Are they still seeing spikes now? Yes, but are there spikes a few thousand cases a day, not 40 to 50,000 cases a day? Yes. I mean, their spike is a very different magnitude compared to ours. We would have suppressed the virus, and we had an early shutdown. We would have saved lives. I would have made sure, if I was making the calls, if I was at least in a place to have influence within government, I would have messaged consistently, especially if the president knew on February 7th that this was an airborne transmitted disease and knowingly withheld that information. That's criminal negligence. I would again lose my license. I might be sued if I had done that, but he still gets to retain his office. If I had that information, I would have made sure the strategic national stockpile was outfitted with N95 masks for our healthcare providers, for vulnerable across the country. And I would have put those wheels in motion early. I would not have waited for the first wave to hit. That's insane to have done that. And then to walk into the strategic national stockpile and realize, oh gosh, hey guys, the shelves are empty. That is unbelievable. So basic things, forward-thinking approach, using information in real time, shutting down the nation early so we could restart our economy sensibly and frankly earlier would have been things I would have done. And then I would have had the humility to listen to the World Health Organization. There are experts there. Do they have issues? Absolutely they do. But what governmental agency, what multilateral doesn't? But governments that listen to the WHO, that actually have the humility to listen to them, not just bluster and talk over them, they're actually doing okay. South Korea, Taiwan, they adopted open source technologies from the WHO, listened to experts, and ultimately they're on a much better trajectory than we are. So it's not that complicated, actually. It's a complicated disease, but if you have humility and if you listen to experts and you listen to the data and you message honestly to the American people, we would have fundamentally not had to have lost 200,000 lives plus, and we wouldn't be living in the current situation that we're living in right now.
Right, that's very logical, everything that you say. If Biden, for instance, gets elected this November, what do you think might happen? What do you think we might expect to see that's different from what's happening now?
I think first and foremost, you're not going to, every single day is not going to be a headline created by future President Biden. It's not going to be about him. And that might seem simple, but that's going to be a sea change. If all you hear is that President Biden and Vice President Harris, hopefully, are elected, they're going to be putting forth scientists and public health experts to the podium to help convince the American people that you should get tested. You should wear a mask, that the CDC is to be trusted and their guidance is now to be trusted, that the FDA is not being politicized, so that when a vaccine does come out, there's trust. Right now, the injury to establishments or governmental agencies that are health-based is so deep that people ask me all the time, hey doc, where do I get my information from?
Right.
And it's a hard question for me to ask, because the way I get my information, the information I trust, is I read 20 scientific journals every week. I can't expect that. And so when whatever platform I have, I try to disseminate that information, but it shouldn't fall to a few civilian doctors who don't have true governmental authority to help guide the country. That's crazy.
And the general public can't be expected to read 20 science papers and then understand what's going on there in order to be informed.
It's nuts. And so, and the general public can't also look to civilian doctors who are not empowered, like myself, to guide them. Dr. Fauci can only do so many things. He's also, to some degree, constrained by what he can say. Folks like myself, we try, but our platform is, of course, not as great as the platform of the President of the United States. And so there's only so much we can do to push back. But I feel for the country. The country is scared. They're anxious. People have legitimate questions about the holidays, about how to keep themselves safe. It's hazy here in the West Coast. Because now wildfires are again happening in parts of the West Coast. It's just there's too many crises happening at once, and what we don't need is a president who's not empathetic. a Surgeon General who barely speaks up and is more worried about holding onto his job than about maintaining his commitment to his oath. And that's not the oath to country. That is an important oath, but his oath to the people through his Hippocratic oath, that's the most important one. And then it's oath to country. Both suggest that he should be doing the right thing and messaging accordingly, and he's not doing that.
And was there a moment that you can recall while this whole pandemic was unfolding where you found yourself sort of just shocked or disappointed by the current government's handling of the situation? Was there one moment when you were watching this all happen where you said, "Oh my goodness"?
There's been a few, I have to say, and here's a few. Here's some highlights. The vice president going to the Mayo Clinic into a COVID unit, not wearing a mask, surrounded by some of the best doctors in the country, all masked. And a message that he was sending that I don't care, I'm looking to please political interests and the president. No, I don't have enough respect for you and the institution, your patients, to follow basic guidelines. The message that sent, the cavalier audacity that sent. I mean, the audacity to do that as a non-expert, as somebody with a platform that people look to, I thought was reprehensible. I thought the president speaking, maybe more than anything, admitting on the Woodward tapes that he willfully lied to the American public about the gravity of this virus, that he knew it was a serious virus on February 7th, that he knew was airborne, and yet then he didn't feel like he needed to caution the American people. If anything, he did the opposite. If he internally knew this was serious and he was not trying to create panic, okay, but then don't work against public health messaging that, oh, maybe masks are actually a really great thing. If he was the president, he was trying to alarm people, he could have at least facilitated discussions on masking. If anything, he did the exact opposite. He said he wouldn't be doing it. So that, again, that is reprehensible. When I saw that, I said, my gosh, of all the things that he's done, that whether you're a Democrat or you're a Republican, if you're a clinician or not a clinician, the fact that he withheld information and tried to dumb it down and frankly just not message on it was pernicious, because people hang on to his word. Some people do trust him to give medical advice. And if he's saying, hey, don't worry about it, but internally he knows, oh, darn, I should be worrying about this. That's horrible. And I say that as a lung doctor. That is horrible, because you know what that means? Those individuals, those poor people should have gotten access, if they wanted it, to say, for example, an N95 mask that's well-fitting, or something like an N95 mask. But because the president had other interests in mind, he stopped the USPS from actually shipping those masks, 5 masks, to households across the country. That was the plan. He stopped it for reasons unclear, number one, but probably related to this whole sort of charade here. And then number two, his eye was off the ball. And so he was just focusing on mixed messaging and disinforming the American public, not actually doing right by people. And so that to me was the two most pernicious pieces here, among a range of examples I could provide you. But the two worst were terrible example setting and then willful withholding of information.
Right. So bringing it back to the South Asian community, how do you think it has affected the South Asian community in America? I mean, has it affected them disproportionately?
The epidemiologic rates would suggest that it's not affecting the South Asian diaspora disproportionately. Is it affecting other Black and Brown communities? Yes. It's affecting African American individuals and those of Hispanic background much more than other ethnicities. And we know that you're 2 times more likely to die from COVID-19 if you're African American than if you're Caucasian.
Right.
I think the data on South Asians is just not as robust, that this is a clear risk factor. What I can tell you anecdotally is I've had friends and family or close friends who've had family members who passed away from COVID-19 in southeastern Michigan. I remember being on the phone with many doctors in Henry Ford when Michigan went through the worst of it. So this hasn't spared our community. I know anecdotally there's been a lot of sad stories, but do I think it's having the same impact on South Asians as it is on African Americans now?
So,
excuse me.
No worries. So so South Asians as a community, there are many young professionals who intend to go into medicine. It's a field that South Asians love. And there are many, many South Asian doctors. And medicine has become somewhat of a sort of a critical care and a frontline service industry due to this pandemic. And people are worried. Parents are worried. Prospective medical students are worried. And what would you say is your prognosis for young professionals and students who want to pursue their careers in medicine as a result of this pandemic? And what does it hold for the future of medicine for us as South Asians?
You might hear different takes on this. My take is there has never been a better time to feel like medicine is truly is living up to the calling that those of us who were pre-med or thinking about a career in medicine years prior to actually applying to med school. There's the calling of medicine, that feeling of public service. Sometimes you feel like you lose that, especially in the middle of hard medical training or taking endless tests. But I think that we've now been reminded why medicine is such an incredibly important and special profession to dedicate one's career to, because it allows you an intimacy at an individual level with patients when they need you most. There's the vulnerability aspect, that intimacy where you can truly feel like you're impacting people in ways in which no other profession will frankly allow you to do so. So there's the individual, the individual interaction that is incredibly meaningful, especially in the current time now when, for example, people that are sick and scared in hospitals can't actually see their loved ones. They have to do it via FaceTime. So it's providers that are not only providing medical care, but are providing emotional care.
Right.
So it's incredibly impactful what medicine is doing right now when people need it the most. And I would also say, of course, there's depending on the nature of your career in medicine, you could focus on individual practice. You could go into more public health, population health, which is what I've tended to do. I'm still practicing clinician, but have diversified. And I would say that if you're interested in more public policy and leadership, there has never been a better time to be a physician or a clinical provider. You don't necessarily have to be just a physician than now, because people are looking to public health experts and docs to guide debates, to take a leadership role, to be the expert who has an opinion on prevailing policy, not just to talk about medical expertise, but to call balls and strikes when it comes to policy. What's wrong, what's not? People have looked to me for that, and I've tried to do it. But I think the only reason they look to me for that is because there's some degree of credibility that comes with clinical experiences and what have you. So it's incredibly powerful, the platform, if you were to choose that. And then lastly, I will say, public health is not going away. When I was coming up the ranks, people liked to talk about public health, global health, going into medicine as sort of a humanitarian interest or side interest or hobby. Now everybody is going to think about public health the way my generation thought about 9/11. My first day in college, I was 45 minutes south of New York City. My first day in college was 9/11. And I had multiple people on my floor at Princeton who had parents in the South Tower who ended up luckily surviving. But then 9/11 dictated all of college, the war on terror. It's part of the reason why I joined the military. And that's why, but that impacted our mindset. For everybody now that's in college, socially distancing learning or doing teleclassroom type environments, this is going to impact your career choices, and it's going to change the nature of your career opportunities, because public health is now viewed as one of the most important considerations for governments to invest in, to think long-term, not just short-term. So it's going to there's going to be a whole range of interesting opportunities that will be afforded to the next generation. So that's why I would encourage people who go into medicine to think broadly, not just about clinical care, but about everything else.
Great, that's excellent. So if you could speak to the South Asian community nationally, they're about 2% of the total national population. So if you could speak to them directly, how would you, or would you encourage them to go out and vote? What would you say?
I would say us as South Asians, we are our South Asian diaspora is one of the most accomplished, talented group of individuals in the country, if not the most talented and most accomplished group of individuals as just a demographic entity. It's just a fact when it comes to sheer accomplishments, graduate degrees, you name it, whatever metric, we're an accomplished bunch. And we should vote as such. And voting should be educated. It should be informed by facts. And we should be leading. We should be saying, listen, us as a group, we're immigrants. We have lived the American dream, or we've been recipients of the privileges that come with the American dream. Because in my case, for example, I am the son of 2 Indian immigrants who've made it successfully legally here and earned everything the way anybody would define the American dream. So we're considered success stories, and we should vote accordingly because our example matters. So voting based on facts and science, not based on just what our pocketbook says, but what's good for public health and the public good matters. And so that example really matters coming from us as an entity, because people look up to us. It may not seem that way all the time, but people look up to the South Asian community because it's a successful group of individuals. We have a time-tested track record. And we are in many ways the definition of the American dream. So we should vote accordingly and set the right example.
Great. And just to wrap it up, what advice, because you are clinically active as well. So what advice would you give all of us about what to expect psychologically, emotionally, physically as we go forward with this pandemic? Because it's not going away anytime soon. So, what advice would you give the community and the rest of us?
As you're entering holiday season, avoid traveling, avoid getting on a flight. If you can drive to see loved ones, that's okay. What I would recommend is in this void of any useful information coming from our federal authorities, what you would want to do is if you're seeing a loved one for the holidays, the last thing you want to do is sacrifice long-term health for short-term happiness. So you don't want to ever put yourself in a situation where you are yourself being exposed to COVID-19 because of a loved one, or you're exposing a loved one to COVID-19. It's not worth the risk, especially in colder climates when people are likely going to have worse outcomes because it's colder, immune systems are more depressed. So what I would say is practice vigilance, avoid unnecessary travel, mask with high quality, well-fitting masks as much as possible. Don't listen to the headlines every single day. It's going to drive you crazy. And prepare that this is going to be a reality for the foreseeable future. Likely Q2 2020 is when you're likely going to get a vaccine in your arm, at least an initial dose. And probably we're not going to be through the worst of it until this time next year. And that's a hard thing to say, but it's important to set expectations so we do the right things. And we're going to get through this. I think we're going to get through this a lot faster if there's a change in administration, but we will get through this. But again, don't sacrifice long-term health and happiness for short-term gain. Excellent.
And one last question for you. So if in the chance that we have to go through another 4 years of the current administration, what precautions should we take? Do you think the policy is going to change if Trump gets reelected?
I think, unfortunately, we're going to continue to have a lot of melodrama. We're going to continue to have a lot of misinformation. I would say until there's a vaccine that has been vetted by an independent advisory board, which is going to be the process, continue to mask, continue to minimize essential travel, get the highest quality mask you can, KN95 masks or something like a 3-ply surgical mask. Those are really critical. I would heavily advise against those who are 65 years and older to engage in any type of social gatherings that are indoors, especially when it comes to the winter months. Because I know our community, we're a really social bunch. Especially I see my parents and their friends. They like to get together. They sometimes like to skirt the rules, to be candid. I've seen this and I've had to upbraid a few folks. What I would say is, again, short-term gain, especially in this era of misinformation, you might be lulled into a sense of false security. Don't do that. I've seen enough bad cases to know that if you end up in the hospital, especially if you have a pre-existing condition, things don't end up well. Don't trust somebody like the president right now who does not have your interests at heart. He only has his.
So in case he gets reelected, you don't really expect the policy to get any better. He hasn't really learned from what's happened right now. You think that the precaution should be on the population to take rather than getting directive from the White House.
Indeed.
Good to know. Well, it's been a pleasure. I know you're
Thanks
on
for having me.
schedule, so I have to let you go.